My name's Tim Marcum. I'm the Associate Vice President of Planning for Baptist Health. I've been with them about 18 years. I have been on the Community Advisory Council of the Foundation for the last 10 years. So I'm very familiar with what they do, and I'm very supportive of its mission. What we're going to be talking today in this session is helping the healthcare workforce survive. We're under so many stresses and strains right now from so many sides, and our panelists today are going to focus on different aspects of helping the workforce be able to continue to do so without burning out. And so our first panelist today, unfortunately, is not going to be here in person. She has contracted COVID and is going to be out, but she was kind enough to go ahead and prepare a presentation on video, and I think you'll find this very entertaining. Her name is Dr. Delanor Manson, and she is the Executive Director of the Kentucky Nursing Association, and she's also with the Kentucky Nurses Foundation, the Kentucky Nurses Action Coalition. She's a healthcare executive and thought leader in her field, and we'll go ahead and start the video.
Thank you for inviting me here to talk about the importance of workplace violence prevention. I am sorry that I cannot be with you today. I have a little COVID going on, I think. And so I really wanted to protect you, but I didn't want to miss an opportunity to talk about healthy workplaces and culture of safety and workplace violence prevention. My name is Delanor Manson, and I'm the CEO of the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. I've come to you with 27 years of experience as a Navy captain, and that plays a part in my discussion because when I was in the Navy as a junior nurse, I was bullied, and so I had workplace violence in my workplace. Nurses comprise 53.3% of the healthcare workforce. Like other healthcare professionals, the need for nurses is great. We have 90,000 nurses in Kentucky today, and we are going to need another 20,000 by 2025. So it is important that we have a safe workplace to help retain and recruit new nurses. It costs approximately $52,000 to recruit and educate a new nurse to an organization. The topic today of this presentation closely aligns with the conference theme, Helping Providers Survive and Thrive. I'm going to cover 4 objectives: to define workplace violence, discuss the prevalence of workplace violence, discuss steps to prevent workplace violence, and then lastly, to discuss bullying and suicide prevention as it relates to workplace safety. A little bit about the Kentucky Nurses Association. We've been around since 1906, and yes, we are 117 years old. And every organization, every professional nursing organization in the state is built on the Kentucky Nurses Association Foundation. In addition to promoting the image of nurses, it's one of our main responsibilities, we have been doing advocacy work and we've been responding to COVID-19. We helped to recruit over 7,000 people to stand up the first drive-through COVID vaccination clinic in the entire United States out at Broadbent in Louisville, Kentucky. After we closed that down, we started doing what we call mobile missions, where we took vaccinations and testing to the community, wherever they were, we wanted to be. We completed over 20,000 tests and 10,000 vaccinations. We were busy people. We were also engaged in advocacy, and I'll speak to that in just a little bit. But we developed a nurse legislator engagement program where we paired 70 legislators with 70 nurses so that legislators had nurses at their beck and call to talk about health and health care, nurses and nursing issues. We completed a Nurses Day at the Capitol March 1st of 2023. I want to remind everybody that every May is Nurses Month, so get ready to honor those nurses. In terms of legislative priorities and our advocacy in 2023, we really focused on the pipeline, that was HB 200, as well as the Workplace Violence Prevention Bill, which we're going to talk about a little bit later. But we also focused on supporting the APRNs and the removal of a Kappa CS. We have our we had our legislative conference, the very first one in May of this year. And we will have our annual conference in November of this year. Our theme for this year, as we're lifting up the brand image of nurses, is there is no healthcare without nurses. And since we're 53% of the healthcare workforce, we know that to be true. So as we're talking about workplace violence prevention, the ANA defines workplace violence as any act or threat or physical violence, harassment, intimidation, or other threatening, disruptive behavior from patients, families, colleagues, or individuals from the outside. And it includes physical, sexual, and psychological assaults. The underreported epidemic has been devastating the industry for years. Studies show that workplace violence can affect the quality of care outcomes, and psychological conditions, and reduce the nurse's job satisfaction and the commitment to the organization. There are some startling statistics about nurses in the workplace. Since 2020, the number of reported workplace violence incidents in the state's healthcare facilities has doubled. 48% of nurses report an increase in workplace violence. 63% of medical providers reported injuries from violent attacks. And healthcare workers are 5 times more likely to experience workplace violence than any other industry, and that includes policemen. Another form of workplace violence is racism. 63% of nurses say that they have personally experienced an act of racism in the workplace. And according to the ANA, racism is violence in the workplace as well. So when we talk about the effects on the healthcare team, healthcare workers and nurses in particular have been hit, kicked, scratched, beaten, spat on, threatened, harassed by patients and family members. And unfortunately, it's regular. Nurses have also been strangled with their own stethoscopes. 80% of nurses reported being attacked on the job within the past year. 70% of all non-fatal workplace assaults causing days away from work in the United States. In addition, violent interactions in healthcare facilities tie up valuable resources so that the needs of patients in many cases cannot be met as quickly as needed. Studies show that workplace violence reduces satisfaction and employee productivity. There are 4 basic types of workplace violence: criminal intent, customer and client interactions, worker-on-worker violence, and then personal relationships. The criminal intent is when an individual from the outside comes into a healthcare facility and harms a person that is working in the healthcare facility. The customer and client is when a customer is receiving care from a provider and they harm the provider. The difficult thing about that is, in many cases, this is the worst day in that customer or patient's life, and they are harming the person who is trying to help them. And then we have worker-on-worker violence. And I can tell you that I was talking to a group of Rotary members just recently, and I was talking about the workplace violence. And this gentleman stood up and he was being very kind and caring and said, I can't imagine that anybody would harm a nurse. And I said, sir, I have statistics to prove that it is actually happening. It's kind of like what I said just a few minutes ago. It's an underreported epidemic. So when we talk about worker-on-worker violence, bullying is one of those forms of worker-on-worker assaults. And that's when one worker assaults another worker, either it's physical or verbal or even psychological. And then, of course, the last but not least is the personal relationship, where a person has a personal relationship with a person who's working in the facility, and they come into the facility and harm that person. Type 2, which is customer, client, and provider, and worker on worker violence are the most prevalent in healthcare. So I want to talk a little bit about lobbying for HB 176. We worked with other stakeholders like the Kentucky Hospital Association and the long-term care facilities to craft a bill, and with other healthcare providers to craft a bill that would work. We approached Representative Jason Nemes to sponsor the bill, and he carried it across the finish line for us. We had over 100 nurses to rally in the state capitol on March the 1st in 2023 in support of the legislation, and to talk to legislators about voting for HB 176. We also did research with other states, and there are approximately 10 that have something on the books related to workplace violence. But most of those states really focused on what to do with people who harm providers or nurses. We wanted to focus on what to do to prevent workplace violence. Prevention is a much better way to retain and keep nurses and other healthcare providers safe. So the Kentucky House Bill 176 Workplace Safety Policy for Healthcare focuses on prevention, not on punishment, after a healthcare provider has been harmed. A brief summary of HB 176. The purpose of this summary is just to kind of give you an overview of what is going to be expected as of January 1, 2024. This bill obligates the Cabinet for Health and Family Services to develop guidelines for health care facilities in conducting a workplace safety assessment and creating the workplace safety plan. It requires the Cabinet to audit health facilities for compliance, and it requires these facilities to develop education, but it gives them a lot of leeway on how they develop the education, as well as leeway in how they develop their safety plans, because we know that there are differences in layout and staffing and security for different facilities. And so this bill allows for a lot of leeway for each individual healthcare facility. And last but not least, this bill calls for facilities to collect data and to do analysis on that data and to do a report on an annual basis. One of the things that's really important about this particular bill is that the ANA has been focused on communicating with the CMS to encourage them to require all facilities that receive Medicare and Medicaid reimbursement to develop a culture of safety, and requires them to keep their employees and their staff safe. And in November of 2022, that was actually passed, and CMS now requires it as part of their standards. In May of this year, we had a ceremonial signing of HB 176 at our first legislative conference. So our overarching goal of workplace violence prevention is to provide a safe environment for our staff, patients, and visitors. It is essential that workplace violence is not tolerated. Creating a culture of safety must be a priority for every healthcare organization, and any organization that really wants to establish a culture of safety can use HB 176 as a template for what they should be doing in their organization. Research by Press Ganey highlights the importance of a nurturing environment in which nurses feel that their physical and emotional safety is an organizational priority. And when they feel that, they are more likely to stay with that organization. As Sam Smith says, stay with me. So organizations are encouraged to use the HB 176 as a template, even if it isn't required for their particular organization. I want to spend a minute or two talking about nurse suicide and how we can all prevent these incidences. Nurses have a higher rate of suicide and risky substance use than other professions. The mental health and wellness of nurses was severely affected by the COVID pandemic, as we all know. Job stressors left unaddressed can lead to mental health challenges. Workplace violence is one of those chronic stress and secondary traumatic stressors potentially increase the incidence of suicide among nurses. HANAC, which is the workforce division of the Kentucky Nurses Association, made a presentation to the Kentucky Board of Nursing in June of 2021 and highlighted the statistics on nurse suicide and those specifically in the state of Kentucky. The Board of Nursing recognized these statistics as being something that we could address if we had a mandatory course on nurse suicide prevention. They decided that that should be put into place, and so the Kentucky Nurses Association developed a phenomenal course on how to prevent nurse suicide. We also developed a course on implicit bias training. We spent $108,000 in developing those two classes, but we think that it was money well spent. So the most important thing for you to know, I'm sure that many of you have taken this nurse suicide prevention course, but this course emphasizes how to start the conversation if you're concerned about someone having suicidal thoughts. So when you start the conversation, you plant the seeds of hope, and hope could prevent suicide. Hope without action will not prevent suicide. One of the things that this course really focuses on is that many people think that it will be insulting and they shouldn't start having that conversation about suicide. But the statistics show that having that conversation could actually save a life. If you don't remember anything about the presentation, but you remember this number, 988, then I will have been a success, which is the National Suicide and Crisis Lifeline number. If you know or you think that someone is having thoughts of suicide, please call the National Suicide and Crisis Hotline at 988 or text helpline to the National Alliance on Mental Health Illness to 62640 to be connected with a trained crisis counselor. I want to briefly talk about bullying because that is workplace violence as well, where a person is doing bullying and it needs to be addressed immediately. Nurses, especially new nurses, should be encouraged to report bullying behavior, but they need to know what it is. There needs to be a system in place for reporting bullying and someone designated to follow up on those reports. Creating a nursing mentorship program for new nurses, and particularly during their first 3 months, is essential to help nurses identify bullying. And leaders need to create an environment of zero tolerance for bullying through accountability. Workplace bullying is also a significant concern in nursing. ANA defines bullying as repeated, unwanted, harmful actions intended to humiliate, offend, and cause distress in the recipient. I would like to encourage you all to take this call to action to protect nurses and other healthcare providers in the healthcare facilities. You can go to the KNA website or the ANA website, and there are a tremendous number of webinars and videos that can help you as you are working towards your commitment to prevent workplace violence. Thank you all very much for inviting me to participate today. I am sorry that I am not able to be with you. I'm sure that the rest of the panel and the panel discussion will be tremendous. Thank you and have a good day.
Wow, she even had music. Yeah, go ahead and give her a round of applause. She can't hear it, but we'll pass it on. Okay, our next speaker today is Charles Aull. He's the executive director of the Kentucky Chamber Center for Policy and Research. He leads the organization's public policy and economic research initiatives. He has a PhD from Indiana University. Yay, IU! I went there too. And has studied at Georgetown University and Villanova University School of Law. I'll let him take it from here. He's going to be talking today about how childcare can impact the workplace.
Well, thank you, Tim, and thank you all for being here today. Usually I try to hide the fact that I'm an IU grad, so it feels good to have someone else up here with me. All right. Well, I knew this is the right place for me to be. As was already mentioned, I'm Charles Aull. I'm the Executive Director of the Kentucky Chamber Center for Policy and Research, and my job at the Chamber is to lead the Chamber's economic and public policy research initiatives. And the way my boss describes my job is Charles, just sit down and think about this for a while, and then come out of your hole. And that's essentially what I get to do. But one of the primary things I've been thinking about lately, in particular, has been childcare, because that is increasingly becoming a pressing issue. And I'll start off with a couple of caveats. First, I'm not an expert on the healthcare workforce. I'm not an expert on the healthcare sector in general. I know enough to be dangerous, but I'm looking forward to learning from you all, as well as my fellow panelists. I'm also not an expert in childcare. I came into working in this space intensely for really about 2 years ago, specifically because it was such a major issue amongst our members at the Kentucky Chamber. We represent industries of all different types and businesses of all different sizes, but especially in the healthcare sector, this is increasingly becoming a pressing issue. And so I've learned a lot over the past couple of years, and again, know enough to be dangerous. So what I'm going to do here today is talk through broadly some of the labor market effects that childcare is having on the ability of individuals to participate in the workforce, the ability of employers to hire, retain talent. We'll talk a little bit about why those challenges are the way that they are, and then move into some actionable items that employers can take, and then also that policymakers can consider to address some of these challenges that employers and working families are experiencing. I want to ground all of this, though, in the broader conversations that have been going on in Kentucky and throughout the nation concerning the labor market and concerning workforce availability. Any employer you talk to these days can kind of speak to the challenges that they have when it comes to hiring and retaining talent. This isn't something that is unique to Kentucky, but it tends to be a little more severe in Kentucky, where we have lower rates of workforce participation, when that includes whether or not you're dealing with adults who are 16 or older, or if you're looking specifically at what we call prime age adults. These are individuals that are 25 to 54. However you slice that apple, Kentucky tends to have lower rates of workforce participation in comparison to other states. The challenge here, though, is that the why of that is something that I think is often incredibly misunderstood and often oversimplified, where a lot of people tend to have, well, I know why this is a challenge, I know why this is a problem, and they tend to focus on singular reasons. Back in 2021, the Chamber did a report on this that I authored, where we tried to make the case that this is a multifaceted issue. It's going to differ from region to region. It's going to differ from individual to individual. There's no one reason as to why we can explain low rates of labor market participation. It really varies from individual to individual. Some folks might have a criminal record. Some folks might have a substance use disorder that they're struggling with. They could have transportation challenges, housing challenges, a whole host of different things. But one of the things we really focused on in this report was that if you are an individual with young children between the ages of 0 to 5, a major barrier to your ability to meaningfully participate in the labor market is going to be childcare. So we're going to turn to that now. This is one of those issues that is both complex and not complex at the same time. From a qualitative perspective, and thinking anecdotally, it's not terribly difficult to understand how childcare can serve as a throttle in someone's ability to participate in the labor market. Simply put, if you're a parent with a young child and you cannot find a safe, healthy place for that child to be about 8 hours a day, you probably just can't work. It's as simple as that for most working families across Kentucky. These headlines here, I think, speak to these challenges. This is something that's been covered nationally. It's been something that's covered throughout Kentucky as well. This first headline you see up there from the Wall Street Journal, it tells this story of a young woman named Kaylee, who was a receptionist at a dentist office, and she found out she was pregnant with twins. And when she looked at the total cost of childcare, it just made more economic sense for her to not work simply because she would be giving up upwards of 40-30% of her paycheck every month just to that expense. And so for her, it made sense to sit out the labor market. We can also look at a whole range of different types of data, though, that helps us understand the impacts that childcare is having on the workforce. This is coming from a unique data set produced by the U.S. Census Bureau throughout the course of the pandemic called the Household Pulse Survey. It has a lot of volatility to it. It's a little bit of an experimental data set, but this just looks at 2022 and takes a look at Kentucky adults who are not working, and their primary reason was caring for children not in school or daycare. If you smooth that out and average it, it's about 70,000 adults who cited that throughout the course of 2022 as their primary reason for not participating in the workforce. We can also look at some really rich survey data, and we're getting more and more of this every day. There's been some that focus specifically on Kentucky lately. One set of survey data, though, that I like to use comes from the Bipartisan Policy Center, which is a 2022 survey of working parents with young children between the ages of 0 and 5. And the findings that they came across, I thought were really, they add a lot of flavor to our understanding of this issue. 38% of these working parents say they've quit a job due to childcare responsibilities. 52% have reduced hours because of childcare responsibilities, and 30% report leaving the workforce altogether at some point because of childcare. You'll note here that I also pulled out the breakdown between women with young children and men with young children. You can see an obvious disparity there. So again, going back to say folks who have quit a job, it's 46% of women versus 25% of men. Folks who have reduced hours, 58% versus 42%. Folks who have left the workforce altogether, 38% versus 18%. I bring this up for two reasons. First of all, women are an incredibly important part of our labor market. If you look at labor market history for about the past 50 years, male workforce participation has been in a state of decline. Women participating in the workforce has essentially prevented that overall workforce participation metric from being in an absolute free fall. So it's a very, very, very important part of our labor market story. But also, if you stop and look at the healthcare workforce, it is overwhelmingly female. And so when you think about the percentage of the healthcare sector that is made up of female workers, and think about some of the or some of those childcare survey data that we were just looking at, you can imagine that the childcare issue might be having an especially pronounced impact on the healthcare sector. So why is this? How exactly is this problem working? What are some of the pressure points, and why is it creating such a challenge? Well, first of all, the availability of childcare is a major issue. And this is another one of those things that varies from Kentucky County to Kentucky County, where in some places it's worse, some places it's a little bit better. But if you look at licensed or certified childcare providers, we have seen a significant decline in the number of licensed childcare centers over the past 10 years or so, roughly about 40% decline. There's some expectations that might get a little worse over the next couple of years as federal pandemic funding runs out. But it's very, very difficult to find in the first place. If you can find it, you might not be able to afford it. This is using some older data. A lot of these numbers are already out of date. So just imagine they're all higher now than what I'm citing right here. But this just gives you kind of a flavor. Crittenden County quality care for a toddler, $6,900 per year. That's about on par with an average mortgage in that area. And those mortgage rates, by the way, account for high interest rates right now. Pike County, similar story there. Quality care for an infant actually surpasses your average mortgage. So it's an incredibly expensive service. Again, noting if you can find it, you might not be able to even afford it. To make matters worse, government support for families who actually succeed in finding childcare, helping them afford it is extremely limited. We do have a wonderful subsidy program at Kentucky called the Child Care Assistance Program, which is very well run, very well structured. Our Cabinet for Health and Family Services does an excellent job at this program. They've been very innovative. However, they're bound by federal law on this. Eligibility for the CCAP program is 85% the state median income. So a family of four, that's going to be about $5,500 a month. And the challenge, though, is once you surpass that income threshold, we essentially offer you nothing. There's virtually no support that those families receive, and so that creates a major benefit cliff. But also, if you're a family working your way up the income ladder, you run out of a whole lot of support, and so this creates a whole range of different problems. Before I jump into steps employers can consider taking to address this problem, I do think it's important to add a little more nuance to this. I've been talking about the ability of parents to participate in the labor force, so the ability of them to be part of the healthcare workforce, for example. We also do need to think about those parents who are making it work, who are figuring out ways to pay for childcare and still working full time. And we all need to recognize the emotional toll that can often take on a family. Imagine working and handing over a fourth, maybe a third of your paycheck to go to these childcare costs, where you're essentially paying to work oftentimes. And just think about the emotional toll that comes with that, the challenges that come with your childcare provider maybe suddenly closing for the day, not having enough workers for the day. A whole number of different things can happen. So there's not only that ability to participate in the workforce, but it's also the quality of that experience. And we talk about things like burnout. Think about this factor, how that compounds some of those challenges. So there's lots that the public sector or the state policymakers can do on this, and federal policymakers, and there's going to be things that the Kentucky Chamber will be advocating for in the 2024 legislative session, but there's a lot employers can consider doing right now. I've had numerous conversations over the past year about steps employers can take to address childcare challenges within their workforce. It's a daunting challenge for a lot of employers because we're talking about opening up benefit packages. That's a very, very tricky space for a lot of employers, especially when they're dealing with other costs, such as, for example, rising healthcare premiums. So this is something that a lot of employers are exploring, but there's quite a few options. I'll kind of start from the bottom and walk through these very, very quickly. There are third-party childcare benefit administrators. There's whole companies that exist whose sole mission is to help you as an employer address the workforce challenges that you're facing. We are seeing some employers offer on-site childcare services. Baptist Health is one of the premier examples of that, and I think they can attest it's something that has produced a really strong ROI. You can also look at a place like Rockcastle Regional Hospital, another great healthcare company that has taken that on. It's not an easy thing to do. It's an extraordinarily difficult thing, but it's an option that's out there. Some companies are offering resource and referral resources, so this is where you're helping employees find childcare. Some are partnering with childcare providers and making reserved slots. We're seeing a lot of employer-sponsored dependent care flexible spending accounts. These work similar to healthcare FSAs. But another program that not a lot of folks are aware of yet is the Kentucky Employee Child Care Assistance Partnership, which is a new program that started operating in Kentucky in July of this year. We're the only state that has anything quite like this, where if you are willing as an employer to offer a financial contribution to an employee's childcare costs, the state will step in and match that on a dollar-for-dollar basis. So it's not a credit system. It's where if they're offering, my employer offers Charles $100 to go towards my healthcare costs, the state will step in, offer another $100, giving me a $200 benefit. And so from the employer side of that, you have an opportunity to double the size of an employee benefit by participating in this program. Participation has been very, very slow. Employers are learning about it, studying it, but it's a really unique opportunity that, again, it's only going to be available to Kentucky employers. Great tool there that they can utilize to address some of these challenges that workers are facing with childcare. In terms of ROI, I'm not going to go through all these things. There's great evidence out there, though, from a survey data perspective. We're still looking for a lot more of empirical research on this, but strong evidence to suggest that employees place a high premium on these types of benefits, and they can be very useful when it comes to talent attraction and talent retention. So there's great reasons for employers to do this from a pure ROI standpoint. Lots of places where you can learn more about this. When you get a chance, go to kychamber.com/childcare. We've produced a whole range of different resources, including information on the Employee Child Care Assistance Partnership. We have a broader employer child care resources guide that gets into tax credits. We also have a recommended employee survey template. And then also the Cabinet for Health and Families website, the Division of Child Care, great information there that a lot of employers could take time to learn about. Okay, with that, I'll stop.
Thank you very much. Okay, our next speaker is Eric Russ. Dr. Russ is a licensed clinical psychologist. He earned his PhD in clinical psychology from Emory University. He completed his internship at San Francisco VA Hospital with a focus on PTSD and postdoctoral fellowship in traumatic stress at Russ University Medical Center in Chicago. He's the executive director of the Kentucky Psychological Association and works as a psychologist who helps people and organizations overcome trauma, move toward resilience. He serves as an elected member of the Policy Planning Board for the American Psychological Association. Dr. Russ.
Thank you. Thanks for having me here today. I was listening to that talk and feeling very grateful that my 5-year-old started kindergarten this year, and we are no longer paying for. Yes, thank you. Yeah, we feel that very much. So I appreciate that introduction. I'd like to know a little bit more about who's in the room. You all have been here for 7.5 hours. Thank you for sticking it out. We're in the home stretch. How many folks are like frontline healthcare workers? Seeing patients. Cool. Mental health folks, my people, a little bit, maybe, kind of. Policy makers, policy adjacent folks. Excellent. Cool. Thanks. How's work, everybody? How are you feeling about your jobs? How many feel stressed by your jobs? Good. How many folks have felt burnt out in the last, let's say, 6 months?
We're taking names, by the way.
If your boss is here, you're welcome to abstain. How many of you know at least one thing the organization that you work for could do to make you a more engaged employee that they're not currently doing? Hands up. Yeah. Great. So I'm going to talk about some of those things today. We're going to talk a little bit about how we're doing as a healthcare workforce. I'm going to talk a bit about understanding and evaluating stress responses, some framework that I think may be helpful, and then what do we do about it at an individual, organizational, and policy level. So our healthcare workforce, as we can see by the folks who are raising their hands, are struggling. COVID has had a really significant impact on our state, on our communities, but particularly on our healthcare workforce. We have workforce shortages. You heard earlier about the nursing shortage. We have a tremendous shortage of behavioral health providers, and our population health isn't good. I'm preaching to the choir. You all know these things. We are not good in terms of poverty, in terms of ACEs, internet access, managing racism and oppression endemic in our society with particular spikes around here, and especially in Louisville, where I'm from. And we have a mental health crisis. Kentucky ranks 37th in behavioral health outcomes. We have higher utilization of behavioral health and mental health services than other states. Most states hover around 15, 18%. We're obviously higher than that, 1 in 5. So what are the consequences of that? Consequences aren't good. So our healthcare workforce is dealing with stress, trauma, burnout, moral injury, other kinds of mental health conditions, and sometimes crisis. I'm going to go through each of these things and talk a little bit about them, and it's not just for an academic exercise, but I think it's important to understand when you're feeling not great about yourself, not great about your work, what's happening? How are you describing that, right? The kinds of problems I'm going to talk about aren't mutually exclusive, but if you can identify the source of the problem, I'm a psychologist, assessment's really important. What's the problem, and so what do you need to do to address that? How do we locate that? So I'm going to talk a bunch about stress, and so I think it's important, obviously, to have a definition of stress, and I use a really basic one here. When your demands, whatever those are, school, work, family, exceed your resources, time, financial, psychological, we can't really change the first two too much. Usually it's pretty hard to change our financial resources, at least over the short term. There's only 24 hours in a day, and you've got responsibilities that you have to take care of. So we've got a little room maybe to address our psychological resources and see if we can do some things to enhance those throughout the day. It's important as you're thinking about kind of stress and reactions to stress, what that looks like for you. Stress reactions vary quite a bit. Anxiety, fear, panic, sadness. I just put some words up here that may describe your experience. They may not. You may have other reactions. It's important to understand the way that you metabolize stress so that you can address that. If you don't know, ask the people that you live with. They will tell you how you deal with stress. Check in with them. They're often good monitors because we're not always the best about telling them if you're stressed, but your partner knows if you're getting a little snippy, if you're not sleeping well, those sorts of things. I also, and this was mentioned earlier in the video as well, if you are in crisis, reach out, call 988. Sometimes we get there, we feel hopeless, we feel alone, and you need to reach out. If you don't have anybody else to reach out to, call 988. It's a great resource. It'll connect you to local resources, and that is available talk about it, spread the word. I know a lot of you do, but I make sure I include this in every talk to remind all of us as providers in particular that it's important that we access those resources as well as share them with our patients. So I'm going to talk a little bit about burnout because this is what we talk about when we talk about workplace stress a lot. I feel burnt out. And a lot of times that ends there. I feel burnt out. We don't really talk about kind of what that means or the implications of burnout. Psychologist Christina Maslach has done most of the work on defining kind of what burnout looks like and measures of burnout. And there are three components that I think it's important to think about where you are on these different components. Exhaustion. So this is just that sense of like feeling tired, right? You're working too many hours, you're working too hard, you're feeling overextended, and you need a rest. Cynicism, that's that sense of detachment related to your job. You're making a lot of negative comments about your job. You're feeling like it's hard to go into work, those sorts of things. And then professional efficacy. And this happens when we don't have the tools we need to do our job, or you're feeling like you have too much work to do your job well. And those things can lead to different kinds of burnout. When we're just feeling overextended, you get that exhaustion driving it. If you're feeling ineffective, you don't have those tools you need to do your job, or you're feeling disengaged, you're just sort of checked out. You've got your retirement timer clock, on your phone. That was my big sign when I worked at the VA. The folks who had their like retirement countdown timer, not a good sign of how you're feeling as an employee. So you want to think about moving towards a place of engagement where you can have low exhaustion, low cynicism, high professional efficacy. Another piece that I like to talk about is moral injury. And this is a relatively kind of newer concept in the healthcare workspace, but has been in VA and around the trauma community a while. So the idea of moral injury is it's something that can occur when you engage in fail to prevent or witness acts that conflict with your values or beliefs. And this idea and concept started taking shape around acts perpetrated in war with combat veterans. And then some people got the idea that maybe it can go beyond that, like we've seen with other kind of trauma disorders. We've seen that with PTSD, other anxiety disorders. Where else does this occur? And healthcare workers turn out to have quite a bit of moral injury because of the ways they're asked to work. And we saw a lot of this during COVID, right? Patient counts were high. People were scrambling about how do we keep ourselves safe? How do we keep our patients safe? Working under conditions that didn't feel okay and having to make decisions that resulted in outcomes that didn't feel consistent with your values, consistent with your training, or consistent with what good care looks like. And we see that in lots of systems today that are overburdened and overworked, where you can't take care of patients in the way that feels consistent with your values as a care provider. And I think it's really important to talk about the values piece of that and the injury that comes with that is different than burnout. It's different than just feeling stressed out. It is an injury to your moral system that needs its own ways of addressing. And a lot of that is organizational systems and organizational cultures that need to do a better job supporting our employees. So thinking about, as you talk to your employees, as you talk to your colleagues, as you think about your own experiences at work, kind of where you're at. Are you just feeling sort of stressed out? Do you have some trauma? Are you feeling burnt out? Is that moral injury piece a part of things? Do you have some other kind of mental health condition? Or are you in crisis where you really need to do something right now? The other piece of this that I want to mention is when you're talking about all of these things, particularly trauma, secondary trauma is a big part of the experience of healthcare providers working with individuals who are suffering. So if you are working day in and day out with folks who are in a tough spot, who have their own trauma, who have their own difficult experiences, you need to pay attention to how much of that you're taking home and taking on, and have resources and be intentional about planning your own ways of taking care of yourself, and if you're an organizational leader, how you are taking care of your staff and your employees who are having these conversations and having these experiences at work. So that's sort of the challenge, right? That's all the stuff that we're dealing with. So what do we do about all that? So this is our basic stress curve. Most of you all have seen this. We need to think about where we are on this curve, right? If we don't have any stress, we're on the left side over there, we're bored. We may be kind of resetting, improving. We need to be operating kind of in the middle of that curve where we have a moderate amount of stress, but not too far on the other side where we start to be ineffective and eventually we need help. So what can employees do? We know what employees can do. It's just difficult to do it, right? So this is some data from the American Psych Association workforce survey. Folks want more flexible work hours. They want a workplace culture that respects time off. All of these things that we know are helpful solutions that employers sometimes have trouble implementing. So time off, flexibility. A big piece in healthcare, especially on the behavioral health side that I see is sort of access versus quality, right? We want patients to be able to get in. We want network adequacy. We want patients to be able to be seen soon, and that results in really high patient loads for folks. And then you have difficulty taking care of people in the way that you are trained to, the way that you need to, and then you get that burnout, moral injury pieces because the drivers are about access instead of quality, and we need to put more emphasis on quality, particularly in our healthcare settings. The other piece is just listen to your employees, right? When folks are raising their hand at the beginning, if they have ideas about what they need to feel more supported, ask your folks what they need to feel support. Talk about stress and trauma. Make intentional space to process the experiences of being a healthcare worker in the modern environment. Create a culture where asking for help is okay. You have to do these things as a leader and intentionally pay attention to them to set that culture in your workforce. Think about workplace well-being. This is the Health and Human Services workplace well-being sort of loop diagram. These are the things to pay attention to. I really like the way they laid this out. As Delanor mentioned in her video, you have to have protection from harm. If you're in an unsafe workplace, none of this other stuff matters, right? If you don't feel safe going to work, you're not going to be an effective employee. That's not okay. I spend a lot of time thinking about the loops on the right, the connection and community and work-life flow, work-life harmony here, and how we create that meaning. That your employees need to have autonomy, competence, and relatedness. They need to be able to get along with each other if you want them to be engaged employees. So we have solutions for how employees can think about this thing. We have models that will work. And you need to be having those conversations among leadership so that you can create the cultures that your frontline employees need to be successful. I'm going to talk for a couple of minutes here about advocacy. We talk a lot about advocacy as a drain, right? It's hard. You go have a lot of difficult conversations with policymakers that don't agree with you or aren't interested in what you have to say. But it's important to do that advocacy because it helps address that feeling of helplessness. Right? So we have a psychology day in Frankfurt, like many of you do with your organizations. When we go up there, we get a whole group of engaged graduate students, many of whom it's their first time doing any kind of advocacy. They're super excited. They're up there. That is inspiring to me, right? These are hard days. We're in the trenches trying to make change in Frankfurt, which is challenging, as you all know. And seeing them and seeing their enthusiasm is really energizing. And knowing that we are participating in the process is energizing. So we want to help think about the advocacy work you're doing as part of how you're taking care of yourself. And if that's not the case for you, if that's just draining and those conversations are hard, support other organizations, donate to your professional associations, and they'll do the work. But also don't think about advocacy just with legislators. Think about it with your teams at work, with senior leadership. Do you have what you need to be effective in your job? Can you ask for that? Can you advocate? Can you organize at work to advocate and ask for those things that support you in your job? And if you're inclined, I think the legislative advocacy is important. We have to continue to advocate for workforce development. We need better data. Emily talked about this a bunch in the presentation, the panel before this, that we don't have good data, particularly in the behavioral health space. We have a ton of licensure types in behavioral health. Nobody knows what our workforce looks like. We know it's really hard to get appointments. We know the access is a problem. We don't have a good picture of what our behavioral health workforce looks like in Kentucky. Reimbursement is still an issue. Employer support. We need long-term state funding for 988. We need local folks to continue answering that crisis line. And we need to promote evidence-based healthcare, which means stop beating up on our marginalized folks. We really got to stop taking it out on our trans allies, and especially trans kids, like happened last legislative session. It's a huge problem, and it's obviously devastating for the folks that affects. It's a problem for our healthcare workforce. People don't want to move here. We've lost providers already. That's going to continue to happen. If we make a a policy environment that's hostile to healthcare workers, that's going to be a problem for access and make all the problems we've been talking about all day worse. So to wrap up here, I'm going to talk a little bit about taking care of yourself. And whenever I talk about this, people are like, yeah, but it's the organizations and policymakers, and that's true. Stay angry at them. So don't forget that organizations and policymakers should be taking better care of you too, and you need to take care of yourself. I think a lot about self-care as leadership. If you are burnt out, if you are overwhelmed, if you are doing those things, it is hard to be a leader. And these things are hard. Work-life flow is hard. How we navigate our work is hard. Navigating childcare, navigating families, navigating care for older adults, all of those things make this hard. So 3 key tips if you just kind of take nothing else away from today. When you are feeling stressed, talk about it. Talk about it with friends, family. If you need professional help, great. Talk about it with your coworkers. If you're a leader, create spaces in your workplaces to do that. Don't avoid the hard conversations and hard things in your life. This is something that I see a lot in my work as a clinical psychologist. People avoid talking about the things that are difficult to them. That makes it worse. Make sure you are getting that out. Spend some time thinking about it. And on the other side of that, make time for yourself and give yourself some breaks. So take care of yourself. Sleep, eating, exercise, pay attention to those things. If they're going well, generally you can kind of manage the rest of it. Think about what you need to build your own toolkit. I put a bunch of stuff up on here. Some of that's going to be helpful for you all, some of it's not. There's a psychologist, Ali Matu, out in California who talks about building a coping backpack, and I really like that metaphor. People like me suggest lots of things. Some of that's going to be helpful for you, some of that's not. You got to figure out what works for you and create routines and continually assess whether or not that's working. One of the things that I found, especially during COVID, was I had to keep kind of reassessing my stress management. So we had 2 kids, they're 9 and 5 now. They were obviously a little younger at the start of the pandemic, working from home. They're running around. They're trying to do remote school for my older son. It was wild, and that was really stressful. And about every 6 months, you had to figure out kind of what's working, what's not. So I would just encourage you all to kind of think about prioritizing what's important. Think flexibly about how you can create a coping backpack for yourself. And collaboration. Who do you need around you to support you? And if there are coping skills that you need, that you want to work on, great. Add those to the backpack. Get rid of stuff that's not working. Think about that as an ongoing process for yourself. So I want to end with just a couple of tips. We're going to do a little breathing exercise together. This is something I do at a lot of my talks, partly because your breath is always with you, right? Many of you know kind of breathing exercises. This is a particular exercise just to slow down, help relax you. It's something you can do in 2 minutes, out in the hallway, sit in the bathroom, do it for 2 minutes, reset yourself between your appointments. So we're actually going to go through this together. I want you all, if you're comfortable, close your eyes. If not, just rest your eyes on the table, on the floor, wherever, and just start paying attention to your breathing. You don't have to do anything different. Notice your breath. You might notice the temperature of the air. And as you exhale, we're going to add the word calm. You're just going to say that word to yourself, calm. And as you start to breathe, we're going to pause in between each breath. And that pause is going to help slow our breathing down a bit. So you're going to inhale and calm. Pause, 2, 3. And inhale and calm. Pause, 2, 3. We'll do one more. Inhale, calm. Pause, 2, 3. When you're ready, come back to the room. If that's helpful, keep breathing. I think having tools like this and sort of things that will help you navigate through your day can be really helpful. If this particular exercise is helpful for you, great. Practice it for 5 minutes a day, a couple times a day, and eventually it'll sort of get to be a routine. Play with the length of that pause, and you can work on something that will be helpful for you, hopefully. The other thing that I want to remind folks is that relational health is important. Relationships are critical. Connecting with other people, colleagues, mentors, friends, family. This was something that got really disrupted, again, particularly during COVID. We started out, I know I did, like my college friends got together and we had our Zoom, meetings that we all sat around and drank at night after our kids went to bed and talked to each other. And then that sort of faded over time. And some of those connections that actually might have gotten a little bit better at the beginning of COVID have faded. And so you've got to be a bit more intentional about how you connect with people and making sure that you are reaching out and getting the social support that you need to do your job and to be effective in your life. So I just want you to think about, really simply, 2 people that you might want to connect with in the next week. It might be people you're already connected to. Maybe you already have a lunch date or coffee date set. But think about it. Maybe people you haven't talked to in a while. Somebody you want to reach out to. There was a really interesting study. One of the things I hear a lot clinically is, I don't want to reach out to somebody who feels intrusive, I'll be a burden. Somebody actually decided to test that and had folks call somebody they hadn't talked to, I want to say, in the last year. So call an old friend, basically, and call them out of the blue and, just talk about them, catch up with your life, have a normal conversation. And then they went and asked the person that they called, was that annoying to you? Did that bother you? Did you feel like that was burdensome? And 90% of people said, no, it was great. Really happy to hear from people. People like being supports to other people, and you really want to take advantage of that. So think about who you might connect with over the next week, who you can reach out to, send a text, make a phone call, those sorts of things. I'll just put up here our QR code. The Kentucky Psychological Foundation, the C3 side of our association work, has a lot of great resources on employee wellness, community wellness. We also have a roadmap to behavioral health that helps folks sort of think about how to find behavioral health, what that looks like if you don't know what different provider types are like. All that stuff is on there. So take a look around. We've been adding a bunch of resources over the next 6 months, and hopefully we'll continue to do that. And that's it for me. So thank you.
Thank you very much. I feel like I should have been on a couch instead of in a chair. We'd like to take some questions now. If anybody has any questions, we'll bring a mic around and let you ask them of our panelists.
Hi, I'm the Team Member Experience Coordinator at Bluegrass Care Navigators, which was formerly Hospice of the Bluegrass. And I think one of the biggest problems we have with burnout is our clinicians are such carers and they're at end-of-life care. How do we help them create boundaries that allow them to have a good work-life balance?
The first thing I would say is just talk about it, right? Make space. I would make that part of the onboarding process and integrate that through all of the work that you do. The other thing is thinking about what leadership can do and what leadership is modeling and telling folks about what they need. It's important, I think, for folks in those roles to understand what burnout looks like, what stress looks like, have the kinds of conversations that we had today so they can think about those things proactively. Make sure there are resources available when they're feeling particularly overwhelmed, that folks are checking on each other, that leadership is checking on the team, that folks aren't feeling too overwhelmed, and that employee benefits are supporting those things. A robust EAP program, for example. All of those kinds of things are helpful, but embedding that into all aspects of the organizational culture of onboarding all the way through the day-to-day work. Is there time during the workday to talk about these things? And are those conversations actually happening? And the other thing is ask folks what they need. Employers are pretty good at telling you what they need to feel supported and figure out how to do that.
Eric, thank you for giving us the term moral injury. Emily and I were immediately like, that's what we feel. But my question is for Charles. I would say that you said like major barrier to our workforce participation is childcare. I would say I don't think that there's anything bigger, to our workforce participation than childcare. My question is, what do you think the budget number is, since we got a budget session coming up? What's that number that we need to solve that in terms of state dollars?
Couple questions baked into that.
There are.
To solve that's a much bigger question than what probably do they need to do in the 2024 session. Top thing I think we need right now is under House Joint Resolution 39, the Cabinet for Health and Family Services is instructed to do a comprehensive analysis of pandemic-era funding. So for some context here for folks, throughout the course of COVID, through the CARES Act, through ARPA, and through some other congressional actions, child care providers received billions of dollars in funding. This was across the nation. That funding, though, came with a time clock. The first clock went off on September 30th of this year. So that was our first fiscal cliff. And the dollars that ran out at that point were what we called these provider stability payments. So these are essentially grants that went directly to child care providers that they could utilize to implement necessary safety measures, particularly in light of the pandemic, but also increase wages, which is one of the most important components of dealing with the child care workforce. Because we talk about workforce challenges, there's also a child care workforce challenge. The second fiscal cliff that we run into is September 30th of next year. At that point, there's going to be changes to the child care assistance program, specifically the income eligibility guidelines, and then also the reimbursement rates that child care providers receive. So we have two fiscal cliffs coming up. That needs to be the priority, addressing those two particular fiscal cliffs right now. What we need, however, though, is we need a little more information from the cabinet. They are actively working on that, is my understanding, to do an assessment of, okay, here's how much each individual program cost. And here's what we think the ROI was, and here's what we think were some of the most effective programs. Because Kentucky did a really good job of utilizing its pandemic-era dollars. Some of those things will be sustainable in the long term. Some of them probably won't. These stability payments, for example, are very, very expensive, and those things were meant specifically to function throughout the course of the pandemic. So I don't anticipate we'll see a continuation of the stabilization payments. Maintaining, though, the income guidelines for CCAP, I think, are extremely important. Maintaining the reimbursement rates that providers have been receiving. In addition to that, Kentucky put itself on the map with another really innovative program they did in the child care sector, which is they did this kind of this sort of, not a policy trick, but they made some changes to our CCAP program to ensure that if you are a child care teacher, child care provider, you are automatically eligible for CCAP. And so essentially providing free childcare benefits to our free childcare subsidies to childcare workers. That's been very, very effective at retaining that talent. So I think what we're going to have to do is kind of think through what these programs have been most successful. The cost of those is actually kind of hard to pin down. And that's why the exact fiscal number, I think, is still evolving and still emerging. But it'll be a large number. But I do think it's important to contextualize that a little bit. Our SEEK appropriation, that's our standard K-12 appropriation for 2024, a little north of $3 billion, funding for post-secondary institutions, direct to institutions, about another $1 billion. So we're spending about $4 billion right there to educate children above the age of 5. For kids between 0 and 4, it's a rounding error at best in terms of the percentage of that. For which? Yeah, are you including the pre-K part? Yeah. But think about, like, narrow that down further, like 0 to 2. I don't know. Yeah, but it's around 10 million, give or take. So there's a huge disparity there. So that's something that I do think needs to be rectified. And there's broader impacts beyond just the labor market. Those are investments that are well spent on children's futures. Baked into that. So there's a strong ROI to come with it. So again, it's a moving target. It's evolving over time. But it is something the legislature will need to take action on. Sorry for the long answer.
I'll keep talking to Charles about childcare.
Well, thank you all very much for coming today. If we could have one more round of applause for our presenters. They did a great job. And thank you all for coming